Whether you haven't taken the NCLEX and is about to take it soon, or if you have taken it once, twice, or it's your third time, there's one fact about the NCLEX exam. It's a hard and difficult exam, and we all know that. It is also a competency exam in which passing or failing reflects on the basis of us being able to answer as much of the required so-called mid-level questions deemed enough to be considered competent questions, okay? And as you know, the more correct questions you get, the higher the quality and the difficulty of the question becomes. And this is done automatically within the system, right? Because the NCLEX is a calibrated computerized adaptive test, or what we call CAT. So basically it's a nursing CAT exam. Now everybody has their own way of studying for the NCLEX exam. But the discrepancy that is false, or that I believe is false, is the idea that the only way to do well on your NCLEX exam is through doing as much NCLEX questions as you can. Obviously, it is somewhat correct, of course, because first, it helps you get familiar with the NCLEX questions that you might encounter during the actual NCLEX exam, right? Second, it helps condition you with a format of what an NCLEX exam would be like. Learning and applying NCLEX strategies such as mnemonics or suffix endings of pharmacological meds is indeed very helpful. There's no doubt about that. But knowing a category of a drug is not enough, because we need to correlate the drug's category and its desired effect, which is the pharmacodynamics, to its adverse effects or side effects, and this can easily be done through content-based linear understanding and learning. So my point is this: everything you're doing helps. All of this is true, but I also feel that you are shorthanding yourself if you don't apply the most effective ways that can increase your chances of passing the NCLEX exam. Let's face it, the NCLEX exam is a content-based exam in which you are being tested based on your overall knowledge of each specific subjects and particular diseases. So instead of me preaching more about the NCLEX, let's go over some of the actual content information that we need to know. Now, the trick here is this: there is so much and plenty of information that we need to learn in a specific amount of time, or whenever your scheduled date to take the exam is. So what we need to do is learn the most important effective NCLEX content in a linear and minimalistic way through audio and video, because that is the easiest way for a short and long-term memory to process and store information. So let's begin with seizures. Seizures, as we all know, is uncontrolled discharge in the brain. And if we're talking about a recurring seizure, that's called an epilepsy, okay? Now, important stuff that we need to know is for treatment or medical management for seizures. When we give a patient phenytoin or Dilantin, and the therapeutic range for this medication, and again we're talking about phenytoin or Dilantin, would be between 10 and 20 micrograms. So over 20 micrograms would cause toxicity to the patient, and if it's below 10, then we are under medicating our patient. And as we all know, phenytoin inhibits the spread of electrical charge within the brain. That's how it works with seizures, okay? Now, when we administer phenytoin or Dilantin to our patient, we need to make sure that it's no faster than 50 milligrams per minute. No faster than 50 milligrams per minute, and we need to administer it slowly over 2 to 3 minutes. We need to take note of the important side effects of this medication, which can include agranulocytosis, which is basically a severe leukopenia, which means that there is such a low white blood count within the patient that it causes the patient to have a suppressed immune system. Therefore, the patient would be at risk for serious infections, okay? So with that, we need to make sure that we check the blood work of our patient. Phenytoin can also cause gum hyperplasia, which is a chronic inflammation, which can lead to severe gingivitis. Therefore, routine oral hygiene is very, very important. So this means that we need to tell our patient to brush their teeth thoroughly. Now let's talk about meningitis, which is an inflammation of the meninges, and it could be viral or bacterial. Make sure you know the difference between a positive kerning sign and a positive Brzezinski sign. It's important for us to know the diagnostic procedures to diagnose a patient with meningitis, most importantly the lumbar puncture, in which if it is positive it would show an elevated CSF and a cloudy white CSF or halo in the patient. When executing the lumbar puncture procedure, we need to have the needle inserted below the spinal cord. Therefore, that means below L3 or L4. And like I mentioned before, the lumbar puncture is used for withdrawal of cerebral spinal fluid. Okay. During this procedure, the patient should be very still for about 45 minutes. If you want to know more important NCLEX contents that you will need to know to pass your NCLEX exam, don't spend hundreds of dollars of your hard-earned money on other NCLEX reviews out there that seemed tedious, boring, and ineffective. Okay? Instead, keep your money and invest in yourself. Take some time to look at the vast information within this website, and when you are ready to pass your NCLEX, then join the course below or on your right hand side, and you will receive the package in your mailbox, which would include an audio review NCLEX CD of more than 30 minimalist, easy to understand NCLEX review tracks. Then you will receive 1 full year access to the NCLEX 26 online course review, which shows you how to review and pass the NCLEX exam within a 26-hour time span. Okay? Also, you'll also have a full year's access to the NCLEX Quickie Notes, which teaches you the most important notes, topics, and information that you need to know just before taking your NCLEX exam. And there's more. You will also receive a lifetime access to the replays of several live NCLEX tutorials. And lastly, as a bonus, you will receive the NCLEX Dark Side course, which gives you a blueprint of how to beat the NCLEX exam. By strategically using a minimalistic linear way of looking at the contents and then dissecting piece by piece the important details and topics and choosing those that are within the competency structure of the NCLEX. So go ahead and either click the link below or the link on your right hand side, and good luck and God bless.